Welcome to our live stream 2, 3, 4, 5, 6 from Deuk Spine Institute. Our patient presents to us from Buffalo, New York with three herniated discs, number 5, 6, 6, 7, and number 3, 4. 3, 4 I don't think is causing any symptoms. I did not recommend any treatment for 3, 4. 2, let's count where we are. 2 is the tall bone, 3, 4, 5, 6. Perfect. So we're starting at 5, 6. We're going to do our discogram. We're going through the front of the patient's neck. The patient is asleep. Very good. Let me get a shoulder pull and let's do a quick shot. Quick shot. Oh, yeah, we're good. There we go. Wow, that's nice. All right, you can see the herniation in the back of the disc right there. The tear is small. The dye is no longer in the tear. It's a big, long tear, but it's not a wide tear, so that's why you don't see a lot of dye. Shot. So far, so good. Okay, 2, 3, 4, 5, 6. Let's get an AP. Give me some num-num. Perfect. Wait a sec. Keep going, Jordan. Actually, just wait on the shot. All right, for those of you joining us, our patient is from Buffalo, New York, came to Florida for 2 herniated discs that are causing lots of pain in the neck, down the left arm. And shot. There we go. You can see the tear. Show the tear on that, Jordan, off to the left. You guys see the tear off to the left? That's the, no, the left. The left. From the tip, go to the tip, and now go to the left. Yes, that's the tear, and it's going and leaking out in the foramen where the nerve root is. That's where the C6 nerve root is, okay? Lateral. So what it means is the tear, which has a herniation in it, which is causing inflammation, is actually leaking onto the nerve root, causing irritation. That's what's causing his arm symptoms. Shot? Yeah. Perfect. Now we're going to make our incision. The incision will be 4 millimeters with a scalpel. So the good news is the first disc we're testing looks like it's a contributor to his pain. It's definitely causing his pain. Now I'm not doing an evocative discogram. I only did a chromodiscogram because our patient is asleep. He's under general endotracheal anesthesia. What that means, he has an endotracheal tube. He's completely out, just like the last one. And by the way, both patients are from Buffalo, New York. Shot. I will say both patients had prior surgery done on their necks to treat a herniated disc, and neither worked. They had foraminotomies. One came to Florida, the other one went to New York. Shot. The foraminotomy doesn't work. That's why I don't do it. If it worked, I'd do it. This is the best treatment in the world for a disc problem in the neck. You're watching it right now. Deuk laser disc repair.
Doesn't stop the inflammation.
Doesn't even treat the herniation. If you do a foraminotomy, you're just removing the bone in the back of the disc. Shot? It's just the kind of things that we do as surgeons sometimes shock me. How ineffective they are and how invasive they are, and that surgeons still do this stuff. Shot? Even though it doesn't work. All right, we're at the front of the disc. We've lost 1 drop of blood. Let's get an AP. Henry, let's show our audience why do cervical disc herniations cause neck pain, arm pain, headaches. Welcome back. You now are experts on how herniated discs cause neck pain. It's through inflammation. Meanwhile, Jordan, take a shot. Show the audience the front of the tube, the tip of the tube that we're going to be working through. It's just there in front of the spine. Show them the esophageal temperature probe. It's braided. Nope, that's the ET tube, yeah. Now the endotracheal tube, which is linear. Very good. We are at the right disc, 5-6, and so far everything is going very well. If you have questions, feel free to ask them by typing them up. We are live streaming surgeries every week from Deuk Spine Institute for the general public to watch. We stream on LinkedIn, Twitter, which is now X, I think, still, Facebook and YouTube. And feel free to ask me questions. I'm here doing surgery. It gets a little monotonous sometimes, and I like to interact and teach while I'm operating, which, by the way, lots and lots of spine surgeons do in academic centers. We teach while we're operating. That's what we do. Usually we're teaching residents or interns or fellows, but for you, you are all my fellows. Of course, don't go out and do the surgery on your own unless you have an operating room and appropriate privileges. All right, any questions from our audience? Shot?
Yes, we have a question from Simo134 on YouTube. And they said, "Hi, doctor. Will a squashed spinal cord from a large central disc bulge reinstate out again to its normal size after its decompression, or is it squashed forever?"
Great question. So the question is, Dr. Deuk-Majan, somebody, by the way, can you get a picture of this, Henry, in a second? I want to show the incision. I'm going to hold things over just a little bit so you can see it better. Can you do that?
Yes, sir.
How does that look?
Looks good.
Is that a good one for the website?
Hold one moment.
And then
yes.
let me put the endoscope over here too. All right, I'm going to put the endoscope in the field as well, so you have it all. Tell me what you think about that picture there. Hold on, let me see. How about that?
One moment.
Actually, Luis, yes, put your thumb right here and pull, just gently. No, here, and pull that way. What do you think about?
The light is giving a little bit of overexposure in the middle of the incision there. It's maybe a little bit too brighter, if I had to be honest.
Too bright or too dark?
Too bright.
Let's do the ceiling. Let's do the ceiling.
Wait.
Whatever that dims.
Wait.
Sorry.
How's that?
Much better. Yeah.
Oh.
That looks beautiful.
All right.
Yeah.
All right, just capture it for the site.
Copy that.
It's kind of nice to have that so people could understand what we're doing. All right. So, to finish answering the question, when you do a decompression of the spinal cord does not always go back to its normal shape. They say that about 50% of the time it does. Sometimes if it's scarred, it'll stay in that same shape, even if the decompression is done. What really matters the most is, are the symptoms gone? And if the symptoms from that disc are gone, then you've succeeded. So those symptoms would be myelopathic symptoms, of course. Numbness, tingling in the hands, balance difficulties, things like that. All right. So it doesn't always go back to what it's supposed to look like, but it can. Unfortunately, the thing about spinal cord damage is that it's usually permanent. Sometimes you get an improvement in function in the patient because the part that is improving is not obviously not damaged. What do you think about this scope? Luis? A little bit.
On the camera or?
No, I don't think it's the camera. Do you? I mean,
I play with it.
Huh?
I play it a little bit with a white balance. And it looks kind of okay. I don't know.
let's just see how it goes. Great questions, by the way, so far. We are at the back of his disc. We are right in the herniation. And I apologize. Sometimes things are a little blurry because the liquid that's coming out from the disc. It could be the camera. Remember, we inject dye, and that dye, and there's also blood, and they can actually obscure the view a little bit. All right. You want to try, Luis?
Different camera or different scope?
No, let's try just taking this off for a second and see if we can improve the interface. Is there anything there? It looks pretty good. Huh? Right? Is it right? Crystal clear?
Yeah.
Yeah, it's crystal clear. How about here? There's something there. All right, let's try that.
Thank you. Stand by. There's another C1 scope. It says it. Yeah, he's in the rack.
All right, let's go back in. And that is a little bit better, but not dramatically. Yeah, I think another one. Where's the pedal? All right. I've got the laser fiber if you want to go.
Yeah. Let me go.
Any other questions, Henry?
Yes, we have another question from Canes25 on YouTube
Sure.
asking, Doc, where is pain commonly generated from the C3 to C4 level?
Where is pain commonly generated from C3, C4 level?
Correct.
That pain is going to be most likely the disc that's causing the pain, but the other thing that could cause that pain would be the facet joints. Facet joints. Most common will be the disc. The disc. Exactly what we're fixing right now, the annular tear. Tell me when you're ready.
I'm ready.
There you go, take it.
Good.
Just hold off on, well, I guess, yeah, we're going to need that too. Go ahead. I can do that if you want. Got it? Nice job. All right, let's see.
Right.
Definitely better.
Yeah.
Can you turn the brightness down? Yeah, yeah.
Okay.
You were right.
Thank you.
It is too bright. I need the pedal. The pedal is too far to the left. I'll get it. Thanks. Okay. Sorry about that. And was there another question?
Yes.
See how blue it is.
This next question comes from Samir on YouTube.
Sure, Samir.
They asked, you were talking about osteophytes before. Does the laser remove it? A couple months back, I was having some balance issues, doctor. Doctor told me something to do with the neck. I've also had herniated discs at my C5 and C6.
Yes, the laser removes osteophytes very easily, as a matter of fact. But like I told you before, we don't remove things that don't need to be removed. So it's my decision as to whether something needs to be removed. And the way I make that determination, I get in here and I look. Okay? An MRI can never tell you if an osteophyte needs to be removed. I can tell you by looking and seeing if it's compressing something it should not be compressing. There are some osteophytes, for example, in this surgery right here where I'm at. Those are osteophytes. But I'm not going to remove every single osteophyte. There's no point. There's no benefit to the patient of removing every osteophyte. And by doing that, you're going to hurt the patient. You're going to create harm. Right? So you don't want to create harm. You want to protect the integrity of the patient's nerves, blood vessels, soft tissues, and their spine. So there's no point in removing osteophytes if they're not needed to be removed. Remember, the osteophytes are your body's way of dealing with this condition, right? Yeah. We don't do cosmetic spine surgery. The surgeons that do cosmetic spine surgery are the ones that have patients who are still in pain after surgery. I'm trying to move this cable. It's not moving. All right. So far, everything is going well. How is he doing, doctor? Stable? This disc is pretty badly damaged. I'm amazed. He's a young man. To see such destruction is surprising. To see so much. I mean, the last patient didn't even have this much damage to the disc. But, you know, everybody's different. And it really has nothing to do with the age of the patient. It has to do with how aggressive their inflammatory system reacts to the herniation. If the inflammatory system doesn't respond very much, then there's not as much scar tissue and not as much destruction. On the other hand, if the inflammatory system responds vigorously, there will be more destruction. We're almost done with this disc. I don't see any more herniations in the crack, but I'm going to pull back a little bit. Usually there's some just outside the tube. Any other questions, Henry?
Yes, next question comes from, excuse me, this comes from Simo134 once more on YouTube, asking, can this endoscopic laser reach all through the foraminal stenosis? Is there limitations?
There's no limitations. This laser is the most advanced, most complete foraminal treatment you can possibly get. There's nothing better. Here, as a matter of fact, that is the foramen right there, where we were just looking. That's where the nerve root is. We're on the side of the spinal cord. I'll show you once again. That is the foramen, and I'm in the foramen, okay, taking pieces of herniation out and taking anything else that I need to take out. That's bone spur right there, but you see how it's not really pressing on the nerve? So, again, I don't remove things that don't need to be removed. Here's a piece of herniation. I'm actually having to cut it because it's scarred down. If you don't have the laser, it's virtually impossible to remove. It is impossible to remove. So the laser is absolutely essential to doing this surgery. Annular debridement. It's not possible to do endoscopically unless you have the laser. Now, you can do it with metal scrapers, big metal scrapers, but why would you want to do that? Then you have to make a big cut on the neck and do an open invasive surgery. That raises the complication rate, bleeding, scar tissue, muscle damage, soft tissue trauma, trouble swallowing, trouble breathing. All kinds of complications happen with open surgery of that type. ACDF, as a matter of fact, has one of the highest, apparently one of the highest complication rates. Now, that said, the reported complication rate in the literature right now that's been accepted by everybody is 50%. Now, I personally don't believe that, but that's what's published, that's what's been reported. And guess who created that number? The implant companies. Not the ones promoting fusion. They would never want to say that. But the ones promoting artificial discs are saying that the complication rate for ACDF is 50%. Now, I've done 1,000 ACDFs. My complication rate was less than 1%. So how is it that other surgeons have such a high complication rate? Yes, I know I'm a good surgeon and all, but really that much difference? I don't think so. There's a bone spur right here. You see this? These little ridges?
Yes, we do.
See how they're not doing anything? We just kind of leave them alone. It's better to leave them alone. Now this, on the other hand, the herniation is doing something. It's pushing on the nerve in the foramen. That has to go. See, it's not the bone spur that's the problem. It's always the herniation that's the problem. The surgeons just show you the bone spurs to get you to do spine surgery with them. I believe people need to know the truth. I just tell them the God's honest truth. Bone spurs aren't the problem. The more people know the truth, the better decisions they can make for themselves. I personally believe surgeons that lie to patients, or therapists, or anybody that lies to patients are wrong. They shouldn't be doing that. I believe in honesty. And I think that doctors should be honest with their patients. The problem is this field of spine surgery, there's so much money at stake, so much to be gained for these surgeons, for these companies, that they can't tell the truth. Because if they tell the truth, the patients won't have surgery. And that would be bad for business for them. Remember, I'm a doctor who's done over 1,000 ACDFs and artificial discs in my career, 26 years. And we even publish them on our website and on our YouTube channel. You can go to our Deuk Spine YouTube and look up ACDF. You'll see I've broadcast many of them. All right, this is one of the last herniations, I hope. Let me get this out, and we should be pretty close to being done. But look how it's stuck down. I'm having to break it up into little pieces because it doesn't want to come out on its own. Okay? We call this debulking. I'm debulking the herniation. I'm taking the bulk out of it. It's a common surgical term and idea. It's not my idea. It's something I was taught, debulking. Normally we reserve it for tumors. Oh, look at that. Just coming out of the foramen. Oh, yes. There it is, almost done. But look how scarred up it is. That's why these things can't come out without the laser. They're scarred down. I'm just delivering it using our shock wave. It's not going to work. It's too big. So I have to go in and grab it. Question.
This next question comes from
Yeah, nice. You see it? Go ahead.
This next question comes from Premier Media Group on YouTube.
Oh, Premier Media Group. I was wondering when they were going to come to the party.
And they asked Dr. Deuk two insurance-related questions. Number one, is there typically a higher rate of approval/reimbursement for cervical DLDR? And two, how can patients get copies of packets submitted to insurance post-op for submissions to Veterans Administration for reimbursement?
Great question. So first of all, to answer your questions, is there a higher reimbursement for cervical? I think you asked. Is that right? Did I hear that right?
Is there typically a higher rate of approval reimbursement for cervical DLDR, correct?
I think they're all abysmally low. We've had, so just to set the record straight, we've had over 100 insurance payments for Deuk laser disc repair. And most of them are lumbar. And that's because mostly we do lumbar surgery, right? So just the numbers. I don't think it's higher for cervical, even though we have peer-reviewed publications. I think the insurance companies are abusive. They don't care about you. They don't care if you have the surgery or not. They just don't want to pay for anything. And they use the fact that fusions are scary and have bad results for people to scare themselves out of surgery, so they don't have to pay. That said, if you want a copy of your claims packet, talk to Julie. You can reach Julie at 321-775-1293. Okay? So give her a call, tell her who you are. Whoops. And and that you want the claims packet for the VA. All right? That's your best option. Almost done. I got another minute left. Good to hear from you, by the way. There's a bone spur. You all see that? Right there? That's a bone spur. But it's not doing anything, you see? So I'm not going to keep working on it because, well, I don't want to hurt the patient. You can have bad things happen. So I don't see any more herniation, just right here, and then we're done. We're done with this level. So let me just check the other frame in one more time. Just some loose fragments, herniation. Looks good. Looks good. I don't see anything else. There's just some scar tissue there, but that's all. I'm not here for scar tissue. I only take the scar tissue when it's holding the herniation in place. All right, very good. That was number 5-6. We're going to move on to 6-7. Any more questions, Henry?
Yes, this next question comes from Canes25 once more on YouTube.
Okay, it's 25.
I think it was a follow-up of their question from pain commonly generated from the C3-4. What body part does the C3-C4 affect?
What do you mean? What body part?
Probably dermatome.
They may be talking about dermatome, like the skin area. It's into the shoulders, top of the shoulder, if that's what you're asking. But C3-4 herniation could cause headaches in the back of your head. They go up to the back of your head, up above your ears on the back of your skull. C3-4 could also cause neck pain high up in the top of your neck, just below your skull. So neck pain that radiates up into the skull, headaches. Also, it can shoot down into your shoulders. Is that where I'm at right now? No. There we go. Beautiful. Okay. So let's just check with, we know our level is 5-6. That means we're going to the one below. Everybody agree? Let's just double check it real quick. Just a slight north shot. 2, 3, 4, 5, 6. All right, so the next thing we're going to do is the Deuk spine slide. I want to point out we've lost one drop of blood. We need to lose 19 more to have 1 milliliter, 1 cc. Crazy, huh? All right, here we go. I'm going to take this tube out and leave my dilator. Shot. Perfect. Let's have a ray. Shot. Uh-huh. Array tech. Shot. Perfect. Hold on. Yep. Shot. That's it right there. Yep. Nice. 2, 3, 4, 5, 6. Okay, I'm going to move down 1 disc. Here we go. Everybody ready? I can see it right there. Here we go. I'm going to come out. Shot. You got to stabilize your hand. I'm going to pop out. This is the hardest part. Shot. I feel like I'm right on the cusp. And I am. There we go. Shot. I'm right outside. All right, now I got to make my way south. Let's get an AP first. Make sure we're in the middle. Remember to always double check. AP lateral, AP lateral. Tell me when you're ready. Everybody in position. Shot. Quick shot. Perfect. Lateral. So I'm out and slightly to the right, which is my side, which is not surprising. But I'm staying direct contact with the anterior longitudinal ligament. And I'm going to do my little shake and slide. Oh yeah. We're going to shake and slide right down to the next disc. Shot. Yeah, I got a little ridging. Shot. Feel a little bit of a ridge heading up. That's a bone spur in the front. Shot. We don't treat bone spurs in the front. Let's get an AP just to make sure I haven't moved too much to the sides. We don't do anything with anterior osteophytes. There's no reason. There's nothing to do. All right, still good. Thank you. I'm going to 50% of the way there. Shot. You just got to do the next 50. Shot. And I am right on top of a bone spur. Shot. Feel like I got it. Perfect. Shot. All right, now I just got to make sure I'm in the middle. AP. Feel like I'm off to the side just a little bit. Quick AP. 2, 3, 4, 5, 6, 7. Yeah. All right, that's fine. That's where we went in last time. But I'm not as far off as I thought I was, so that's not bad. Shot. It looks good. Here we go. Shot. Entering the disc. Let's just get one more AP to verify. Remember, Deuk spine slide, first in the world. 2, 3. That looks good. It looks good. This is never easy to get to 6-7. Never easy. It's always the hardest, and 7-1 is even harder. It's almost impossible. We would probably not be able to do 7-1 on this patient if I had to. But 6-7 is definitely doable, and we're about to do it. Is there a frog in the operating room? Shot. Shot. That should do it. Perfect. We got the dye in. Shot. Nice. Any questions while we're doing this? There's our second drop of blood.
Yes. This next question comes from SJ Education King on YouTube.
Hello there. Welcome to our live stream.
They asked, I have huge bone spurs paracentral C5-C6, my CT showing. Is it possible to repair with the laser?
No. No, it's not. If you have, so welcome to our live stream. Thanks for asking. If you have gigantic bone spurs, I mean, I'm assuming what you're telling me is the truth. And I'd have to see them myself. Shot? But let's assume for a moment that I agree with you. You have huge bone spurs. We cannot do this particular surgery. It will not work. That said, I've never seen somebody with huge bone spurs. It happens once every few years. So if you have what's called OPLL, which is ossification of the posterior longitudinal ligament, that's a different scenario. And once again, you cannot do this surgery for OPLL. It will not work. But we can do other surgery. We can fix you at Deuk Spine. We fix people with huge bone spurs, OPLL. I would probably recommend, depending on how many levels, if it's segmental or continuous, I would recommend going in the back of your neck and doing a decompressive laminectomy and possibly fusion. Shot? I just need to see your CAT scan first. So happy to look at it for you if you want me to, but you'll have to do a submission, MRI review. Okay? And we can put the link for that. All right, we lost 2 drops of blood, the whole surgery, and we're ready to fix the second disc, number 6-7. Keep the questions coming. I'm happy to answer them.
This next, I believe, is a comment from Canes25, once more on YouTube.
2 drops of blood.
And they said, Canes25 said, it is astonishing watching you becoming one with the dilator after doing this thousands of times. It's amazing how easy you make that look, knowing how difficult it is really without damaging any vital tissues.
Thank you, sir. Honestly, it means a lot to me to hear you say that. It means you truly appreciate what we do. Thank you. You know, I learned a lot watching Star Wars when I was 7 years old. I am one. Yeah, Dr. Berndes says he is one with the laryngoscope, and I am one with these metal instruments. But thank you. It really genuinely means a lot to hear you say that. Thanks. Okay, so we've got the laser at 12 o'clock for those of you who are new to this. You can see the metal tube. I'm sliding down, down, down. We know that the tip of that tube, right there where it ends, is at the back of the disc, right where the herniation is. This is the herniation that I'm zapping right now. And it's not a bone spur, but it is calcified a little bit. That's what the gold stuff is, okay? And the laser fiber you're seeing there is a straight firing laser fiber. And I only use straight firing laser fibers. Other doctors will use side firing. There aren't a lot of us, but you know, like Dr. Chol Kim out of California, he's a friend of mine. He'll use side firing. I don't like the side firing for various reasons. I like the straight. And I made a comment last surgery, why change something that isn't broken, right? If it's working, stay with it. As a matter of fact, when the company that manufactures the endoscope came to me and said, hey, stop using that endoscope. We got a new one. Buy it and use it. I looked at it and I said, well, this endoscope is much bigger, like fatter. It's going to hurt the patient more. I said, no, I'm not going to do that. Of course, they stopped talking to me after that, but I got to do what's right for the patient, not what's right for the companies. And they kind of promised me that they would pay me money to go and teach other surgeons that and help me teach other surgeons doing this if I started to use the new endoscope. And I just told them to, I'll say it nicely, go suck an egg. Again, I will never compromise quality of my work for anybody or anything. It's too important to me that patients have a doctor who actually prioritizes their results more than anything else. And a team that prioritizes their results more than anything else. So, Very interesting. This here is the posterior longitudinal ligament right there. And right there is some granulation tissue. Remember we talk about the red stuff in the lower back? That's it. Inflammatory tissue. That's where his pain's coming from. So pretty fascinating. We don't see it as well with the cervical scope because the cervical scope is a smaller scope. It is not a rod lens scope. It's a fiber optic scope. And as such, fiber optic scopes, well, they don't have as good visibility. And maybe that's what that guy was talking about, Henry, a couple of weeks ago, when he was saying you intentionally blurry the scope.
Oh, yeah.
Remember that guy? He's like, why are you intentionally blurring the scope?
Like,
I'm like, I'm not. Trust me. I wish I had better visibility. There's nothing. Huh? Conspiracy theorist, right?
yeah, it's like we want to do that. No, you know.
I'm the guy with the conspiracy theories, and he's blaming me for having for being a conspiracist. So, whatever. But yeah, the cervical scopes never have the visibility. I got about 5 minutes, maybe 8 minutes at most left. The cervical scopes are different. They're fiber optic, so the quality of the image is not as good because the transmission of the image through the scope is reduced compared to the lumbar rod lens scopes. But it's the best we can do, and it works. Remember what I said, proof's in the pudding. Proof's in the pudding. This is all scar tissue right there. I'm going to flip back. Looks like we got some herniation here. Any more questions?
Yes, this next question comes from Premier Media Group once more on YouTube.
Uh-huh.
Asking Dr. Deuk, what other types of MRI records can folks submit for free review besides spine? Like what knee, hip, shoulder, elbow diagnosis would benefit?
Yes. Yes. Hey, thanks for bringing that up. You are correct. We are launching our new website called Deuk Joint Institute because we're now treating more than just the spine. We're treating knees, hips, and shoulders. So thank you for mentioning that. And probably even elbows someday. That said, it's not launched yet. And I think it's going to be probably another couple of months before they finish the site. It's not going to be as sophisticated as Deuk Spine. It's called Deuk Joint. And you don't even need to submit your MRI, actually, the images, believe it or not, because the doctors that do the Deuk plasma rhizotomy for knees, hips, and shoulders, they told me they don't need the actual MRI images. They can actually just go off the report. So it's going to be a lot easier to submit hips, knees, and shoulders for evaluation for the Deuk plasma rhizotomy procedure than it is for the Deuk laser disc repair for the discs, because I've got to see the MRI with my own eyes, but apparently they don't for the other joints. So they being Dr. Patel, Dr. Davis, probably Dr. Francis Cheney. So for those of you who don't know what I'm talking about, Deuk Spine Institute doesn't just do spines. We do joints, like hips, knees, and shoulders as well. However, we've never really formally created our own joint center. It's mostly been spine, but we also do joints. So now we're creating a formal joint company that deals with joints, because we've made a discovery, probably one of the biggest discoveries in medicine in the last 50 years. And that is, oh, look at that herniation. That is that we can get rid of joint pain in your knee and hip and shoulder without doing open surgery, without taking your joint out and giving you an artificial knee. Well, all these other orthopedics are trying to do knee replacements, hip replacements galore. We now have a technology that gets rid of the pain in the hip and knee. Oh, yeah, that's fine. Without opening you up. And people go back to work the next day. So it's pretty incredible. We're still developing the educational materials, so we're not quite there. We're a small company. We don't have big marketing budgets. Matter of fact, I do most of the work as the CEO because we don't have the money to do it. So I have to sit there and write this stuff up myself. All right, who else has a question? Just about done. Another 2 minutes, we should be done.
No current questions, but we do have a comment from Cosmic Knight on YouTube.
Cosmic Knight, welcome. Good to hear back from you, Cosmic Knight.
They said, Dr. Deuk, we very much so appreciate your honesty. I just learned that I lost my neurosurgeon at Sylvester due to my insurance, United Healthcare.
Sorry, yeah.
Not covering facility charges. I get PT now.
I'm so sorry. I hear this all the time. Cosmic Knight, I want you to know something about United Healthcare. They are the richest insurance company in the world. They made $5.3 billion last quarter. Billion in profit. This should be the last herniation. Please, folks, we need to fight these insurance companies. We need to stop them from just stealing your money and not paying for the medical care you guys need, and just only offering you barbaric treatments, okay? And the only way it's going to happen, let me show you the herniation that just came out. It's the last one. All right, turn the light on over here. This is pretty cool. It's a good size herniation, right? You guys see this? I just pulled it out of the tube. Henry, you see that?
Yes, we do.
So this is a good one for the website too, by the way. Maybe a picture of it coming out of the tube. What do you think about that?
Yeah, right there. Looks good.
All right, and I'll put another one right here. So that thing is 5 millimeters. Look at that, 5 millimeters wide. See that?
Perfect.
All right, that's the last one. I didn't see any more. We're done. So, folks, you got to rise up and fight the insurance companies. They're literally killing people. They're destroying people's quality of life by not paying for services. By the way, there's 5 hospitals in Massachusetts now that are closing down because they can't make enough money. They call it low reimbursements, which is the amount what the insurance companies pay the hospital is reimbursement. Well, the thing about it is there's 4,500 hospitals in the United States. So what they're trying to do is put out of business about 25% of them. And the 25% or the 75% that are left are basically doing whatever the insurance companies want them to do, like accepting their shitty payments, but just enough to be on life support, you know? But they're closing down as many hospitals as they can. The insurance companies are underpaying hospitals. Hospitals are going out of business, and it's going to make it harder for people. Forget about surgery like mine. Who cares, right? I mean, this is important, but it's not life-saving surgery. The hospitals that provide life-saving surgery are going to be closed. So when you have a blood clot in your brain and you're literally herniating and dying within 30 minutes, you need that skull open and the blood clot sucked out. And the hospitals are gone. There won't be any hospitals. You guys are going to die. I mean die like dogs too. And it's already happening, by the way. Nobody talks about it except me. And trust me, I'm going to be very loud about it very soon. As long as my director-producer comes through with what he's supposed to do. We're going to expose all the corruption. All right, let's type up questions. I'll come over there and answer. I'm going to go see the next patient who's a lumbar Deuk laser disc repair, 3-level. That'll be our next case.
And good morning, I'm Dr. Ardik Majan, CEO and founder of the Deuk Spine Institute. I'm here with a patient who has traveled here to have his neck fixed. He had a herniated disc. We did his surgery just yesterday.
Yes, sir.
It was outpatient, Deuk laser disc repair, endoscopic. How do you feel today?
I'd say probably 90 to 95% better, for sure.
Awesome. And what kind of problems were you having before that brought you here?
Severe balance issues, tingling in my arms and fingers. I had pain running down my leg, but I don't have nearly anything today, so big difference.
And your insurance covered your surgery, is that correct?
Absolutely.
And who do you have to thank for that?
Well, we've got you for one, and your whole staff has been friendly and kind, and you guys have always been on point with everything, getting back to phone calls and emails. It's been a hell of a process. Much appreciated.
You're welcome. And are you taking pain meds now that your surgery's over? A lot of people that have spine surgery, they're on painkillers for months afterwards. Are you on any painkillers?
No, sir, not at all.
None.
No pain enough to need pills.
Awesome. And you can see the small little incision. We went in with a 4mm incision on his neck, and we went through the front, back to the back side of the disc that was herniated, and we used the laser to clean out your herniation and get the pressure off your spinal cord and your nerves. Here you are now. Were you offered other types of surgery besides the laser?
I was a disc replacement of the C4-C5, I believe, and maybe C6. The recovery time was 6 months, 6 to 8 months of no working, no lifting, none of that stuff. I chose to go with Dr. Deuk just simplistically of, his overall success rate and the transition of being able to get back to work and getting my life back.
Awesome. And you don't have a piece of metal in your neck?
No, sir.
It's all natural. We went in and used a laser to repair the disc, and there's no metal, no plastic, nothing left in his body. You get your natural spine. Anything else you want to say to your fans out there?
Hey, believe in Dr. Deuk and the Deuk Spine Institute.
Awesome. Thank you so much.
Thank you.
All right. Good morning, I'm Dr. Deuk Majan. I'm here with one of my patients who underwent surgery yesterday with the Deuk laser disc repair on his cervical spine. And he's here less than 24 hours from his surgery. And how are you feeling today?
I'm feeling great. No more neck pain, no more arm pain.
So you came to us here at Deuk Spine because you were having neck pain and it was going in your right arm and it was affecting your work, your quality of life, right? Tell us about that.
I first started noticing a lot of arm pain and a lot of weakness in my right side arm, and that's my dominant arm, so I knew something was going on. And then finally I went and saw my primary care, who took me to a MRI, and that's when I noticed that I had some issues going on. And he referred me to Deuk, and I'm very pleased that I didn't have to search around. I was real confident from watching all the videos and testimonials that I would be the right choice.
Yeah, and you can see in your surgery here, we made a tiny little cut on your neck in 2 spots. 4mm because you had 2 discs that needed to be fixed or were separated. And we used the laser to remove the herniations along with the endoscope. We did an annular debridement, cleaned up the tear that was there in the back of your disc. Everything went really well. You didn't have to have a fusion, did you? I mean, that's what most doctors will tell their patients. They need a fusion or an artificial disc.
Correct, I didn't have to get the aggressive plates put in. I'm real happy that it was just 2 little holes. That's it.
And it was outpatient.
Yes, I was home laying on my couch within an hour after the surgery. So
Within an hour. Yeah, that was nice to be able to recover at home.
Yeah,
Not have to go to the hospital.
correct.
Well, is there anything else you want to share with your audience?
My wife and I both came in a little nervous yesterday, and the staff just comforted us and very professional, very caring, explained everything from the beginning to the end. We were very pleased that we chose this route.
So what's life look like for you now that you got these symptoms gone?
I'm hoping to go sit on the beach this afternoon.
And you will. Very good. Congratulations on taking it and doing so well.
Thank you.
All right. Have a nice day. I'm Dr. Deuk Majan. I'm here with one of my patients on February 1st, 2023. And you just had surgery on your neck, the Deuk laser disc repair done with a 4mm incision to fix 2 herniated discs, her C6-7 and her C7-T1. And you had a long neck. We were able to get down to the C7-T1, and she had a very large herniation there. So your surgery was about 24 hours ago. How do you feel today?
I feel like a different person. I feel I was able to do many things this morning that I haven't been able to do for 4 months, and that is just get out of bed and just take my first steps and have 0 pain. And I haven't had that in 4 months. First step out of my bed was always the beginning of my day, and it was awful. And today, I took my first step out of the bed, and it was glorious.
Good for you. And before surgery yesterday, you had been suffering for about 6 months with neck pain going into your right arm, correct?
About 4 or 5 months.
How did that affect your quality of life?
Every day is difficult. I mean, I have a 10-year-old and a 5-year-old boy, and just the basic duties of a mother every single day was just unbearable and difficult. So quality of life was not very good. And so it is now.
And so the pain, obviously, because of the pain, activities would set it off. So you were limiting what you were doing. You were limiting what you're able to do as a mother.
Yes, there was things I were not able to do, and be the best mum that I can be was not one of them.
Well, you look very happy right now.
I am.
Why are you so happy?
Because I'm pain-free.
Yeah, and you didn't have to have a fusion or an artificial disc put in your neck, did you?
I did not.
Did anyone offer those surgeries to you?
I did. I was offered those surgeries. I was told that I needed a fusion, the possibility of disc replacement in 1 or 2 years down the road, but it was my decision to go in and have those taken care of if I wanted to. But there was also a possibility that once the doctor got in, that he could not replace those 2 discs, so he'd have to fuse those 2. So that to me was a possible 3 fusion, 3 discs being fused. Mm-hmm. And I know the consequences of that, so that's why I came for your opinion, in your professional opinion, what can be done in a less evasive way. Or that was an option for me, and here I am.
And I'm really happy it worked out for you. You can see in the video, we were able to get down to C7, T1, which is really a first endoscopically. And, because you had that nice long neck, we were able to do it. And there was huge pieces of herniation down there. Your other disc was more degenerated, and we were still able to get that fixed as well. So I'm very happy you're doing well. What's life going to be like now that your neck is fixed?
My quality of life is just going to be a lot better than what it was. I'm going to take it easy, and I know that I need to take it easy, and I'm going to be careful, but I'm going to wake up with a smile on my face now instead of tears.
Well, congratulations.
Thank you so much.
Is there anything else you want to tell your fans out there?
Come see Dr. Deuk. He'll fix your pain and make you walk out with a smile on your face.
Excellent. All right. Good to see you.
Thank you. Thank you so much.
Welcome. I'm Dr. Deuk with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Okay, sorry about cutting that testimonial off for those who are looking forward. You can see our testimonials on our YouTube channel. We have hundreds upon hundreds of testimonials from patients that we fixed. Every single one of them mentions their cure, and no narcotics, no painkillers the next day. We don't put people on narcotic painkillers. If anything, a Tylenol at night, maybe a muscle relaxer pill called Robaxin, and that's about it. The surgery you're watching does not require opioid narcotic painkillers. It's one of the big advantages over other surgeries. People ask me, what is the difference between the Deuk laser disc repair and other types of surgery? We always talk about the trauma to your tissues under the skin being a major factor. However, other things include the use of postoperative painkillers, which you don't use for Deuk laser disc repair. All right, any questions or comments?
No current questions, but we do have a couple comments. This first one comes from Callie on Facebook.
Kelly, welcome.
They said this surgery is life-saving. You're giving patients their quality of life back.
Yeah, you're right, Kelly, and I'm sorry. I didn't mean to offend anybody. I usually call it quality of life-saving because that's what it is. And honestly, I know that there are a lot of people out there whose lives are destroyed by chronic pain, whether they turn to alcohol and drugs to treat themselves, they turn to opioids, and then they're losing their job, they're on the street, they're trying to get opioids because they get addicted. It's horrible. What the insurance companies are doing by denying you patients this surgery and not covering it is literally criminal in my mind. And the problem is the insurance companies control our politicians. They fund our president to get elected. They control all the senators and congressmen. They make sure that their agenda is met. And their agenda is one thing, folks. It's called denials. Look it up. It's a terminology used in healthcare where the insurance companies don't pay. The hospital, the doctor, the anesthesia, whoever, the therapist, it's called a denial. And the denials are destroying our healthcare system. The denials by insurance companies, while the insurance companies are raking in billions and billions and billions and billions of dollars in profits, those denials that feed their profits are destroying our American healthcare system. It is 100% fact. And just type into Google hospital closures, and you will see what I'm talking about. It's quiet. The media channels do not talk about the hospitals closing because they don't want Americans to panic. But for the last 10, 15 years, hospitals have started closing quietly. Hospitals don't want to broadcast it for several reasons. One of them is, of course, it's embarrassing when your leadership at the hospital fails to keep the hospital going. So the leadership that makes the decisions about whether to broadcast their failure, they don't want their failure smeared all over the news. So they quietly close. And the insurance companies just continue to suffocate our healthcare system. That we used to be, when I started as a medical student at USC in 1994, America was #1 in the world in healthcare, #1. That's 1994. That was 30 years ago. We were #1, and we were proud of it. And you know what? If you talk to anybody on the street, any doctors, they say America's #1. Of course, America's #1. Everyone knew America was #1. We didn't have any. It wasn't even possible that another country could be better than us in healthcare. But in the last 30 years, the health insurance companies have rewritten the laws, and they have started to slowly suffocate our healthcare system by denying payments for treatments. Denying payments. And it's not just my surgeries they deny everybody. As a matter of fact, we've seen American medicine shift from 90% of doctors in private practice running their own practices, having a direct relationship with the patient, to now 95% of doctors working for hospitals, because doctors cannot stay in business. Not because our costs are too high, because we're getting denied payment by the insurance companies. The problem is the insurance companies pay us after we've already provided the service. Well, imagine if you're a restaurant and 90% of the people that come to your restaurant don't pay their bill, they just walk out. How can you possibly pay for the food that you're going to provide the next night? How can you pay the rent, the electric bill, the water bill? It is impossible. So that is what's happening in our healthcare system. The insurance companies are doing it on purpose. They want to limit your access to doctors and hospitals. And America has got to wake up. We are living in the freaking matrix, and it's disgusting. And I'm like, what's his name?
Keanu Reeves?
No, not Keanu. I'm like
Morbius.
Morbius. I'm Morbius, trying to wake you guys up and make you aware. I'm not Keanu Reeves. I can't fix it. I can only show you the problem, and then you guys have to fix it. It has to be a grassroots effort. Any questions?
No current questions.
Have a wonderful afternoon. We have 2 more surgeries coming up. We've done 2 cervicals. Each one is a 2-level. You could see they're both 5-6-6-7 disc herniations. Both patients did very well. No problems with the surgery. And we lost 2 drops of blood. That's pretty impressive. That's what endoscopic is for you. And then the next 2 are lumbar. This next lady, I forgot where she's from, but she's a 3-level lumbar. And she's here with her husband, and I can't remember, but I'll figure out where they're coming from, but it's another state. and then we got one more afterwards, a 2-level lumbar. So hopefully you'll join us. I'm Dr. Deuk Majan, CEO and founder at Deuk Spine.